everyone. I wanted to hop on here and just film a quick update. So as of the last video I shot with you guys, I was working with my urology team to kind of figure out what was going on with my continuing UTIs, or urinary tract infections. I have filmed, I don't want to keep too much information repeated in each video, but if you have any questions on hysterectomy with injury to the bladder, what that's kind of like, what it's like to go home with a urinary catheter so your bladder can heal, and dealing with chronic UTIs and trying to get to the crux of what's causing that, I have a whole history of videos on this channel, so please feel free to watch those. You can kind of watch them in order. None of them are too terribly long. So at this point, we are 1 year officially post-op, and I had recurring UTIs nearly every few weeks each month since. I have been sick this past year with UTIs that were absolutely horrible, and I couldn't get to the bottom of what was going on. It wasn't hygiene, it wasn't anything. But I have been on antibiotics basically off and on, with maybe a week or two in between, for a year. I mean, I was taking the prophylactic dosing with my primary care provider, and I had another, that was 3 months, and then I had another 3 months of the prophylactic dosing, which is like one small dose, usually once a day, of an antibiotic. I have a cold too, so I sound just amazing, but so I did that. I took that prophylactic dose for 3 months with the urology team, and I'm on technically the third. So you're looking at 9 months of taking antibiotics non-stop with no break, right? A little after having my hysterectomy, I was having these gushes of fluid that I could not tell because you're sore and everything was operated on, and I'm busy throughout the day, so it's really hard to analyze where this is coming from, but I would have these gushes of fluid. It was like a pale yellowish fluid, but I couldn't tell if it was urine or what. I thought it was like pus or something, because when you are taking antibiotics, it upsets, of course, the vaginal flora and pH and environment, and causes a whole host of problems. So I've had kind of off and on yeast infections in addition to urinary tract infections because of always taking antibiotics. It's just part of the journey there with that. So I would treat those and move on. But I had this watery gush throughout the day. It would be every few hours. Basically, this would require me to wear a light pad or a panty liner all the time, morning, noon, and night. As soon as I get out of the shower, I'd have to put one on right away. So it was this unpredictable passing of fluid, and I was none the wiser that this was connected to my UTI. I had no idea. So at one point, I think I was about 2 months in with urology, taking this prophylactic, just mild dose once a night. I messaged the urologist, and I just asked, I said, would it be normal to just be passing urine, or is my urethra inflamed? Would that be vaginal? I mean, I have these gushes of fluid, excuse me, and I have to wear a light pad all the time, and this is just, it has gone on, and I apologize if it's unrelated. If I need to speak to my gynecologist about that, certainly, if we feel like it's a vaginal issue and not a urology issue, because you have to understand, if you're working with a specialist, that's their scope, not everything else. They will refer you, but so basically he said, yes, that would be very helpful if you could meet with them so we could kind of narrow that down, because that would be very bothersome. And he said that would actually be very indicative of you potentially having something called a vesicovaginal fistula, which is an abnormal connection between the bladder and the vagina. So a fistula is any kind of connection or abnormal little pathway between two body systems, two organs that really should not naturally exist. So that's what I had. He said, I feel pretty sure that that's what we're dealing with, and that would be very, very helpful in working with your case of the chronic UTI. That would really kind of get us somewhere, because we've had now a cystoscopy and a cystogram, and I'm not seeing anything that's causing this. I don't see anything. So he said, I really want to refer you to one of my colleagues who is a DO. He's a doctor of obstetrics, right? He's an obstetrician and gynecologist, but also has a specialty in urology, which is, I would imagine, very rare. It's like being a double specialist, right? So I was referred to him. I had a cystoscopy with him, which was inconclusive. There was, completely unremarkable results. There was just nothing that he could kind of zone in on other than the repair side that they were monitoring. And he said, really, it looks fine. That's about what I would expect a year post-op. And at that point, he recommended that I do a tampon test. He said, I want you to go home, if you have tampons, or if not, buy some. I want you to wear a tampon and take azo, because azo will turn the urine, that orangey, bright, orange color, right? He said, I want you to hold that tampon, wear that tampon in your vagina for as long as you can, a few hours, and then remove it very carefully, and we'll see what's going on. So I had to empty my bladder one time. He said, if you can, try not to get any of the urine on the string, because then it's going to travel up the tampon. I really want to get a good test. So I held my bladder for just short of 4 hours. It was 3 hours and about 45 minutes, give or take, where I held my bladder, and I did not void or empty my bladder. So upon removal of that tampon, I did have very obvious orange dye, which was the presence of urine in the vagina. And he told me, whatever comes to pass with that tampon test, I want you to upload that image to me through the portal. Message me and let me know you did the tampon test. And he wrote back, I think a day or so later, and said, yeah, that's a good indication. That's what we need. So you do have a fistula. You have a connection between the bladder and the vagina. We have a lot to talk about. So we scheduled a follow-up visit in office, and he kind of ran down all of the surgical ins and outs and what's going to be going on. So I am now scheduled for surgery to have the fistula repaired. It's a fistulotomy. Basically, they have to go in and remove the fistula. That actual tissue will have to be removed. So he's going to have to actually cut a larger hole in the vagina and bladder, I think. But I basically will be sent home with a bladder, a Foley, what do you call it, a Foley catheter for 3 weeks. So that's pretty much standard for continuous drainage to allow the bladder to heal. So that's where we're at. I do intend to film post-op, maybe not in the hospital, because I was really loopy on morphine last time. I wasn't making any sense. I don't know if I'll have that this time. Probably not. But I don't want to film anything that's excessively wordy or not useful. This is, again, I'm not a YouTuber. That would be very evident. I just want to film this experience, if this would help even one person. That is my hope. So please stay tuned if you have any questions on hysterectomies or wearing a catheter at home, what that's like, or also if you've ever had a fistula, connection between your bladder and vagina. I will have some more information and hopefully be able to share that with you in these next few weeks. My surgery is scheduled for about 2 weeks from today, so that update will be coming to you very soon. So please stay tuned. Please check out my other videos if you're interested in any other, again, hysterectomy or Foley catheter questions. I have a few videos here on my channel to help. But thank you so much for watching and for checking out my video. I appreciate it. Again, this is just for educational purposes. I am not a medical professional. I am just a person that has had this surgery and now approaching my second surgery to get better. And I just want to share that information with you. That way you might be a little bit more informed if you have this coming up in your near future. So take care, stay healthy, and I will be talking to you all again very soon. Thank you so much. Have a good one.